I never dreamed when I moved out to San Francisco from Staten Island that my life would change in so many different ways. One was to find my sexuality, and two, I became an activist on workers' rights, and that was the beginning of my activism. And then when the AIDS pandemic began in the early 80s, I felt that as a lesbian, my community was dying and I needed to do something. And that's when I got involved in being an AIDS activist and did many demonstrations and patient advocate, and also talked in front of OSHA about discrimination within my facility of healthcare workers not wanting to take care of AIDS patients.
Yeah, about 10 years ago, Peggy and I were working on the same floor in the hospital. And it was just when the HIV epidemic was starting to roar and people were getting sick by the hundreds and people were starting to die. And the hospital had a lot of AIDS admissions.
Yeah, it's really bad.
There were always 5 or 10 people on our floor who were admitted with AIDS-related conditions. And their treatment was absolutely substandard. People weren't getting their sheets changed. People weren't getting their fevers treated. And it was all because of completely irrational fears about contagion. And this was, I know that this was after it was firmly established that HIV could not be casually transmitted.
Initially, as healthcare workers, we were taking care of strangers as patients. But as the epidemic wore on, suddenly the beds were filled with our co-workers. And by 1987, for the first display of the NAMES Project quilt in Washington, D.C., we had lost 19 fellow employees. And we were devastated as a workforce by losing our friends. And when I first heard of the NAMES Project and I spoke to some of the people that had done panels, I realized that it was a process of healing to do these panels. Peggy did Tom Oates' panel, which is immediately above her.
He was my best friend. He was my coworker. He was like a brother to me. After he died, I was in a lot of pain and I didn't know what to do with that pain. And all of a sudden I realized that a group of people were putting together the AIDS Education Committee at the union. And I thought, well, I could take my grief and my anger over the care of AIDS patients and what's happening and be on this committee helping to develop AIDS brochures. And with the help of the International Union, we were able to publish them, and we are now in our 5th edition. We educate shop stewards so that they can better represent the healthcare workers in the union against needle sticks, about health and care safety committees, and to keep them better educated. AIDS is the #1 epidemic. I think everyone realizes that. And I think that the international and the local union have joined together and we've created very positive things.
We sent around that petition to the doctors and
remember that?
the technologists and the RNs, and basically the petition said, we want an inpatient unit that's dedicated to taking care of people with HIV disease, and it should be staffed by people who want to work there.
Right, including housekeeping.
People that work on the AIDS unit work there exclusively. They don't do any other sort of hospital care or patient care.
Both of us got positions on that unit.
My impression was that the patients and their families really appreciated it and could tell the difference. I mean, it still wasn't the most avant-garde care that people with HIV should get, but it was so much better.
Oh, yes. It was much more personal. And you got to know the patients and their partners and their families. There were people there that were just like new grads out of nursing school, and they were really brave.
They were.
You know? And especially Melissa.
Melissa was great. Yeah.
It was very hard for me when I received a call from Melissa in her telling me that she had AIDS and that she was very sick and that she thought that she had less than a year to live. The unit was understaffed, and she had people working with her that were not the regular staff, and she was overwhelmed, and she was the only RN on, and she got a needle stick.
She got such a deep stick too, and she went to the emergency room, but before she did that, we were both pulling on her finger like crazy to express as much blood out as we could. And
which is all that we knew to do at the time.
Right.
You know, and to put alcohol and Benadine and to go to the ER. But, you know, AZT was not offered to healthcare workers because the CDC, quote, said that healthcare workers were at the lowest risk of conversion.
Right. Melissa was so brave, too. She came back from the emergency room and she started to sob. But then, after about a minute, she pulled herself together and finished her shift.
Right. Melissa went through a lot of changes. She was, at the time, going to get married, and so we had to get her on medication, which is called TPN, in order to get her strong enough so that she would be able to get married and be able to walk down the aisle. She was very thin and very weak, and it was very difficult for her. But she did do it, and the marriage went off without any problems. This was something that was her dream. She wanted a husband and a house and children, and none of these were ever going to be a reality, and Melissa knew that. And we talked at great length about it. Towards the end of Melissa's life, her husband couldn't handle it, and he left, and Melissa started to file for divorce. Melissa had a lot of anger at that point, and that's a natural course in the dying process. You go through, you know, the denial and the bargaining and the, you know, the anger, and then finally the acceptance. But Melissa, anger didn't really affect me very much since I worked in the field and saw this a lot. I would just, you know, bring to her attention and say, you know, let's talk about what you're really mad about. And Melissa did finally come to acceptance, and she was slowly becoming comatose, and she was waiting for this newspaper article, and it took a long time for us to get that, to have them printed, until finally I called them up and said, listen, you know, this woman is dying, and, you know, she wants to see this article. They finally printed it, and Melissa was, at that time, in a coma, but I believe that people still hear. And I got the paper that day, I read the article to her, and I could see all of a sudden this calmness. There was no more struggling. There was just like this serenity that came over her. And she died that evening. And her grandmother and her aunt and Soon and I were there. I told them all to come quickly. And we all gathered around her and held her and told her we loved her. And Melissa took her last breath and she died. And I lost a very good friend that day. And the world lost a very good nurse, and a very compassionate one.